One of the endocrine functions of the pancreas is to secrete a hormone called insulin into the blood. Microscopic regions of beta cells in the pancreas are located on the islets of Langerhans. These beta cells release insulin. After consumption of a meal, increasing amounts of glucose in the blood trigger beta cells in the islets to secrete the appropriate amount of insulin hormone, which travels through the bloodstream to target cells, where it promotes the transport of glucose into the cells. Glucose must get inside cells to participate in cellular respiration, which creates the energy needed for cellular processes. Certain tissues, such as skeletal muscle and adipose tissue, require insulin to unlock their cells before glucose can enter. Insulin attaches to specific receptors on the cell's surface, causing glucose transporter proteins in the cell membrane to open, allowing glucose to pass into the cell. As cells take up glucose, the blood glucose level falls. Type 1 diabetes is a disease in which the pancreas loses its ability to produce insulin, resulting in high blood glucose levels and other metabolic complications. In this disease, antibodies secreted by lymphocytes attack and destroy the beta cells, so the pancreas produces little or no insulin. Lack of sufficient insulin prevents glucose from entering cells, resulting in a high blood glucose concentration, a condition called hyperglycemia. Unable to pass into cells, glucose builds up in the blood. The kidneys filter out the excess glucose, which is lost in urine, resulting in glycosuria, resulting in large quantities of glucose in the urine. Common symptoms of hyperglycemia in type 1 diabetes include polyphasia, or excessive eating, polydipsia, or excessive thirst, polyuria, or increased urine volume, and unexplained weight loss. As the insulin deficiency continues, cells are unable to use sugar for energy, so the body breaks down fats and proteins to use them as an alternative source of energy. As fat breakdown continues, acidic byproducts, known as ketone bodies, accumulate in the blood, resulting in a condition called ketosis. If allowed to build up to dangerously high levels, a life-threatening condition called diabetic ketoacidosis results. Type 1 diabetes can cause degenerative tissue damage, resulting in long-term complications such as atherosclerosis, blindness, neuropathy, and renal dysfunction. Licensed health professionals prescribe insulin replacement therapy to treat type 1 diabetes. If a diabetic person uses a syringe to deliver doses of insulin, he or she must rotate between injection sites to prevent localized tissue damage and absorption problems. Once delivered via syringe or insulin pump, the insulin rapidly reduces hyperglycemia, facilitating transport of glucose into cells. Insulin also suppresses ketosis, restoring metabolic balance. In addition to insulin therapy, patients must manage their glucose levels closely with frequent glucose checks, which should fall between 70 and 120 milligrams per deciliter. Patients should also monitor their blood glucose level with periodic hemoglobin A1C tests, which measure the amount of glycated hemoglobin in the blood over a 2 to 3 month period. Although insulin therapy is the cornerstone of type 1 diabetes management, treatment involves a multifaceted approach to ensure optimal blood glucose control and minimize complications. Apart from medical interventions, lifestyle adjustments play a critical role. Consistent carbohydrate intake, along with the appropriate timing of meals and snacks, helps balance blood sugar levels. Patients with type 1 diabetes often work with dietitians to create personalized meal plans that include balanced macronutrients and limit simple sugars. Physical activity is equally important, as it enhances insulin sensitivity and aids in blood glucose regulation. However, exercise must be carefully planned and monitored to avoid hypoglycemia, a condition where blood glucose levels drop too low, leading to symptoms such as dizziness, confusion, and even loss of consciousness. Adjusting insulin doses or carbohydrate intake before and after exercise is often necessary. Moreover, emerging technologies have revolutionized diabetes care. Continuous glucose monitoring, CGM, systems provide real-time data on glucose levels, alerting patients to trends or potential issues. Advanced insulin pumps can communicate with CGMs, automatically adjusting insulin delivery to maintain blood glucose within the target range. Research continues into artificial pancreas systems, which aim to mimic natural insulin regulation. Beyond managing immediate symptoms, preventing long-term complications is a critical focus. Routine screening for cardiovascular health, kidney function, and eye health is essential, as type 1 diabetes significantly increases the risk of atherosclerosis, diabetic nephropathy, and retinopathy. Regular foot care is also important to prevent infections and ulcers, which can arise due to poor circulation and neuropathy. Despite these challenges, people with type 1 diabetes can live full and active lives by adhering to their treatment plans and staying informed about advancements in care. Education, support from healthcare professionals, and access to resources empower patients to manage their condition effectively. Type 1 diabetes is primarily an autoimmune disease, where the body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. These beta cells are located in specialized areas called the islets of Langerhans. The exact cause of this autoimmune response is not fully understood, but a combination of genetic predisposition and environmental triggers is believed to play a significant role. Specific genes, such as those in the HLA, human leukocyte antigen complex, are associated with an increased risk of developing type 1 diabetes. Environmental factors such as viral infections, early exposure to cow's milk, or vitamin D deficiency during infancy might act as triggers for the immune system's attack on the pancreas. Unlike type 2 diabetes, type 1 is not linked to lifestyle or obesity. The disease often manifests suddenly, typically in childhood or adolescence, though adults can develop it later in life. Early diagnosis is critical to prevent severe complications, such as diabetic ketoacidosis, DKA, which can be life-threatening. Glycated hemoglobin is created when glucose attaches to hemoglobin within red blood cells. Glycated hemoglobin forms at a rate that increases with plasma glucose levels. The desired hemoglobin A1C level for people with diabetes is less than 7%. The higher the hemoglobin A1C level, the higher the risk of developing complications from diabetes. Other actions patients can take to monitor their glucose levels more closely are diet control and consistent exercise. By treating and controlling blood glucose levels, patients may prevent the occurrence of the complications of diabetes. Role of insulin. Insulin, a hormone secreted by beta cells in the pancreas, is essential for regulating blood glucose levels. Its primary function is to enable glucose, derived from the digestion of carbohydrates, to enter cells and be utilized as energy. Tissues like skeletal muscles and adipose tissue rely on insulin to unlock the cells and allow glucose to enter. Without insulin, glucose remains in the blood sugar levels, or hyperglycemia. Over time, chronic hyperglycemia can lead to systemic damage, affecting organs and tissues. Insulin also plays a role in inhibiting the breakdown of fat, lipolysis, and protein, promoting energy storage and maintaining metabolic balance. In individuals with type 1 diabetes, the complete or near total absence of insulin disrupts these processes, leading to severe energy deficits and metabolic complications like ketosis. Symptoms. The symptoms of type 1 diabetes often develop rapidly over days or weeks as the body's insulin production diminishes. The hallmark symptoms include high blood glucose levels draw water out of tissues, causing dehydration and a persistent feeling of thirst. Polyuria. The kidneys filter excess glucose from the blood, which pulls water along with it, resulting in increased urine output. Polyphagia. Despite high glucose levels, cells are deprived of energy, signaling hunger. Unexplained weight loss. The body breaks down fat and muscle to compensate for the lack of glucose uptake, leading to significant weight loss. Fatigue? Lack of energy production at the cellular level causes persistent tiredness. A pause, a sound that recognizes the tears, is. Blurred vision. High glucose levels can cause swelling in the lens of the eye, impairing vision. If untreated, these symptoms can progress to severe complications such as diabetic ketoacidosis, DKA, characterized by nausea, vomiting, abdominal pain, rapid breathing, and confusion. Diagnosis of type 1 diabetes involves several tests to confirm hyperglycemia and its underlying cause. 2151. Fasting blood glucose test measures blood sugar levels after an overnight fast. Levels above 126 mg/dl indicate diabetes. Results 5.2% in the green color. Random blood glucose test. A blood sugar level of 200 m/dl or higher at any time suggests diabetes, especially with classic symptoms. PBONC test. Reflects average blood glucose levels over the past 2-3 months. An HbA1c level of 6.5% or higher indicates diabetes. Autoantibody testing detects antibodies that attack pancreatic beta cells, helping distinguish type 1 from type 2 diabetes. C-peptide test measures the level of C-peptide, a byproduct of insulin production. Low levels confirm diminished or absent insulin production. Timely diagnosis is essential to start insulin therapy and prevent complications such as DKA. If not managed effectively, type 1 diabetes can lead to both acute and long-term complications. Number 1. Diabetic ketoacidosis occurs when the body uses fat for energy, producing acidic ketone bodies. Symptoms include nausea, vomiting, rapid breathing, and confusion. Without treatment, DKA can be fatal. Hypoglycemia. Overdosing on insulin or skipping meals can lead to dangerously low blood glucose levels, causing symptoms like shaking, sweating, confusion, and seizures. Cardiovascular disease. High blood sugar damages blood vessels, increasing the risk of atherosclerosis, heart attacks, and strokes. Neuropathy. Nerve damage leads to numbness, tingling, and pain, especially in the extremities. Nephropathy. Kidney damage due to high blood sugar and hypertension can progress to kidney failure. Retinopathy. Damage to retinal blood vessels can lead to vision loss or blindness. Regular monitoring and strict glucose control are crucial to prevent or delay these complications. Treatment. The cornerstone of type 1 diabetes management is insulin replacement therapy. Different types of insulin are used to mimic the body's natural insulin release. But the various styles of insulin can mimic rapid-acting insulin, taken before meals to control blood sugar spikes. Long-acting insulin provides baseline insulin levels throughout the day. Insulin can be delivered via syringes, pens, or insulin pumps. Advanced insulin pumps offer programmable delivery rates and greater flexibility. Consistent monitoring of blood glucose levels ensures that insulin doses are appropriately adjusted. For severe hypoglycemia, glucagon injections may be required. Emerging therapies such as islet cell transplantation and immunomodulation offer potential for improved outcomes in the future. Blood glucose monitoring. Frequent monitoring of blood glucose levels is essential for maintaining tight glucose control. Tools include fingerstick glucometers, provide quick readings of blood sugar levels. Continuous glucose monitors measure interstitial glucose levels in real time, offering trends and alerts for highs or lows. Maintaining glucose levels between 7, 0, 1, 2, 0 mg/dl reduces the risk of complications. Periodic HbA1c testing complements daily monitoring, providing an overview of long-term glucose control. Lifestyle management, diet and exercise are key to effective diabetes management. Patients work with dietitians to plan meals that include balanced carbohydrates, proteins, and fats. Regular physical activity improves insulin sensitivity and helps maintain blood sugar stability. However, patients must monitor glucose levels before, during, and after exercise to avoid hypoglycemia. Proper hydration and carbohydrate adjustments are critical for safe physical activity. Technological advances, innovations in diabetes care have transformed management strategies. Continuous glucose monitoring provides real-time glucose readings and alerts for high or low levels. Insulin pumps deliver precise doses of insulin, often integrated with CGMs, artificial pancreas systems. Combine CGM data with automated insulin delivery, mimicking natural insulin regulation. Mobile apps help track glucose levels, insulin doses, and meal data, simplifying daily management. These technologies enhance glucose control, reduce the risk of complications, and improve quality of life. Education and support. Managing type 1 diabetes requires comprehensive education about the disease and its management. Patients and their families learn about insulin administration and dose adjustment, recognizing and treating hypo and hyperglycemia, meal planning and carbohydrate counting, the importance of regular exercise, and its effects on glucose levels. Support groups and diabetes educators provide emotional support and practical advice. Ongoing communication with healthcare providers ensures that treatment plans evolve to meet individual needs, empowering patients to lead healthy, active lives. 1 diabetes is a complex chronic condition that requires diligent management and a multifaceted approach to care. Advances in medical science, innovative technologies, and comprehensive education have significantly improved the quality of life for individuals living with this condition. By understanding the disease, adopting healthy lifestyle practices, and adhering to treatment plans, patients can achieve better glucose control and reduce the risk of complications. While a cure remains elusive, ongoing research offers hope for future breakthroughs. With the right support, knowledge and determination, individuals with type 1 diabetes can lead fulfilling and productive lives. Not merely a medical condition, but a way of life that demands perseverance, adaptability, and support. Through understanding its causes, recognizing its symptoms, and embracing the advanced treatments and technologies available today, individuals can navigate the challenges of this disease with resilience. Let us continue to advocate for research, spread awareness, and offer unwavering support to those living with type 1 diabetes. Together, we can inspire hope and empower individuals to live not just with diabetes, but beyond it, achieving their goals, dreams, and fullest potential.